The history begins with the discovery of noradrenaline and adrenaline in 1948, and he concluded that both transmitters have different effects depending on the type of receptor that they bound, which are alpha and beta receptors. Then, in 1957, he found out that alpha-adrenergic blocking drug can act as both agonist and antagonist. In 1987, benign prostate hyperplasia has first been diagnosed and alfuzosin became the standard alpha-1 adrenergic blocker drug used to treat benign prostate hyperplasia.
Yes, come in.
Assalamualaikum, Doktor.
Waalaikumsalam. Have a seat. Good morning. May I help you?
Good morning, Doktor. Lately, I have a frequent and urgent need to urinate. I also feel like it is difficult to start urination, and I don't feel like my bladder is empty, even though I urinate frequently. So, how is it, Doctor?
Do you urinate frequently at night?
Yes, Doctor, and sometimes I can see some blood in my urine.
Based on the symptom you mentioned, I need to have you for urine test in order to analyze your urine sample. Then we would know the causes of the symptom. I'm sorry, Mr. Yash. After a few repetitions of the urine test, we are unable to detect the cause of the symptom to happen. However, we will try our best to find the actual disease for this symptom and consequently the cure for this problem.
Okay, so what I have to do now?
You have to go home first and I will call you later. If there any problem, you can come back to see me again.
Okay, thank you.
Dr. Alia did some research from various sources and she discovered that Mr. Yash had been diagnosed with benign prostate hyperplasia.
I think Mr. Yash has prostate enlargement and it's related to benign prostate hyperplasia. I should to refer my pharmacist. Hello, Lukman. I need to discuss something with you. We should meet somewhere. Sorry for taking your lunch time, but I had something urgent to discuss with you. I want to refer the medication that I had to prescribe to my patients. He had been diagnosed with BPH. This is my patient's report.
Let me take a look first. I think this is a rare case. So I need to consult with my colleague first. Okay?
If that's so, I will leave this case to you. If you find the cure, just let me know, okay?
Okay.
Thank you.
Due to the case that Lukman received, he need to find the drug and the cure that will be useful for treating benign prostate hyperplasia. After several tests and research, with the ups and downs that Lukman had gone through, he finally found a suitable drug to treat benign prostate hyperplasia, which they named as alfuzosin. After the discovery of alfuzosin, Lukman asked their colleague through email to help him on determining the efficacy of alfuzosin. After a few years, his colleague managed to send him the reports on how they test the alfuzosin.
Well, it's been a long time since we last met, since I got the drug sample from you, I guess. From the drug sample alphazoxine that I have received, we have been conducting some preclinical trials and in vivo tests to determine the safety and efficacy of the drug. For the in vitro test, the alphazoxine was tested on some rats during a juvenile rat program to test its toxicology, and it was determined that no death was recorded, showing that it is safe to be used. For the in vivo test, one of them was held in Thailand on male patients of 18 years old and above. This trial focuses on the testing of the new formulation of alphazoxine, Zetra XL, in patients with lower urinary tract symptoms, LUTS, suggestive of BPH. The patients were given 10 mg alphazoxine tablet once daily after the evening meal. From this trial, we have found that there is improvement in the urinary symptoms and quality of life index as the primary outcome measures, and for secondary outcome measures, there are improvement in sexual function as well as the maximum urine flow rate. The other trials also illustrate positive results. Hence, from these preclinical trials and tests, it is confirmed that alphazoxine is safe to use and it is effective in treating patients suffering from BPH. Bye, Lokman. See you soon.
Hi Luman, how have you been? I have received your email regarding the question on production of alphazoxine. So for the production of alphazoxine, first you need to react 4-amino 2-chloro-6,7-dimethoxyquinozoline with 3-methyl aminopropionitrile with the presence of acidic reagents selected from sulfonic acid such as paratoluene sulfonic acid. This reaction also need to be carried out in alcoholic solvent selected from isoamyl alcohol such as ethanol in the temperature of 50 degrees Celsius to 80 degrees Celsius. And then the propionitrile compound will then be hydrogenated using nickel in an alcoholic solvent with the presence of ammonia and about 1 to 20 kg of hydrogen pressure at a temperature of 30 degrees Celsius to 80 degrees Celsius. This reaction will produce an amine compound which will be converted to alphazoxine by the reaction with tetrahydrofuran to carboxylic acid. This reaction need to be carried out in an appropriate organic solvent such as methylene chloride at a temperature of negative 5 degrees Celsius to 10 degrees Celsius, and then the alphazoxine will be converted to hydrochloride salt form by the treatment with ethanolic hydrogen chloride, and then the alphazoxine will be produced. So I hope that my explanation on production of alphazoxine is clear, and if you have any question you can call me again. Bye.
Hi Lukman, regarding the alphazoxine, I have conducted the clinical trial. The first phase of clinical trial, a number of 360 patients were underwent emergency catheterization and then were blindly randomized to alphazoxine or placebo. After 3 days, we found out that alphazoxine can help to increase the rate of trial without catheter compared to with placebo. In the second phase, all patients with successful trial without catheter were then randomized again with alphazoxine or placebo for 6 months. After 6 months, we found out that those who were treated with placebo have higher need for BPH surgery compared to those who were treated with alphazoxine. In the third phase of clinical trial, a number of 1,177 patients were involved. In this phase, we tried to determine the superiority of alphazoxine compared to placebo and the tamsulosin. Unfortunately, there are some adverse effects in this phase, so a new formulation of alphazoxine is needed. In the fourth phase of clinical trial, 118 patients were treated with alphazoxine. to assess the safety profile and efficacy of new formulation of alfuzosin. After all the approval criteria was met, it was found that alfuzosin can be used to treat BPH up to 1 year. After the size of prostate reduced back into its normal size, the use of alpha-1 blocker can be discontinued. Next, Ashira will talk about the adverse effect during this clinical trial.
Assalamualaikum warahmatullahi wabarakatuh. So now we talk about the issues regarding alfuzosin. So when we talk about the issues, it is none other than the adverse effect shown by alfuzosin. So in a clinical study where 473 people were given 10 to 15 milligram of alfuzosin for 3 months. Surprisingly, after 3 months, we found out that 68 of them showed the symptoms of adverse effect, where out of these 68 people, 27 experienced dizziness, 14 experienced headache, another 14 experienced upper respiratory tract infection, and the rest 13 experienced fatigue. If we compare with the placebo group, only 47 of them showed these symptoms. So we can say that the ones receiving alfuzosin showed greater adverse effect compared to the one receiving placebo. Not only that, out of these 473 people also, 30 of them showed the symptoms of orthostasis, which were dizziness, hypotension, and syncope, while for the placebo group, only 27 of them showed these symptoms, but only dizziness, not with syncope or hypotension. So from this study, we can conclude that alfuzosin actually contributed to the adverse effect that I had mentioned earlier. So it is clear that alfuzosin had an issues, and the adverse effect issues is mainly the contributor.
Good morning, Lukman. It has been a few years since alfuzosin is released to the public, and within those period, I have received a few reports from the consumers regarding the side effects that they experience after they consume alfuzosin. First and foremost, some of them might experience dizziness, headache, and fatigue, and the other cold symptoms such as stuffy nose and also sneezing. The side effects might be mild side effects and could also lead to the severe side effects. In order to address this issue, we have come up with a few solutions, such as to give the patients a lower dose of alfuzosin for their first dose, because this could reduce the side effect that they might experience later. They also need to take alfuzosin before bed, and they need to prevent themselves from handling machinery and also drive after they consume alfuzosin. For those who have severe side effects, they need to refer to the doctors and they need to stop the medication immediately. Not to forget, before alfuzosin is prescribed to them, we need to ask the patients whether they have any medical conditions or the allergies, because this factor will affect how alfuzosin will be prescribed to them later. Okay, that's all from me. Have a nice day, Lukman.